Hi everyone, Assalamu alaikum. Thanks so much for joining us today. So I will start today's webinar. We are here today to discuss the COVID-19 vaccines. We have an esteemed panel with us, so thank you very much to our panel for joining us. We are the independent members of the Anti-Muslim Hatred Working Group, and just to kind of give you a very brief overview who we are, we were set up in 2012 to consider and take forward proposals to tackle issues of anti-Muslim hatred in the UK. The working group is a government working group, and we're made up of representatives from Muslim communities, independent experts and academics who are known collectively as the independent members. We're also made up of various different government departments. Our group covers a wide geographical spread across the UK, and we have representation from various different traditions of Islam and Muslim community groups, but also we have a member from the Sikh community as well, and other experts. All our members are appointed by Her Majesty's government. So why are we sort of doing this webinar today? Well, we were concerned by the reporting and stats that there might be a disproportionate number of people from the Black and Asian ethnic minority communities who will not take the vaccine. It's been almost like a shining light at the end of the tunnel, the prospect of having vaccine and getting the population, the entire population vaccinated. But this news that Black and Asian ethnic minority groups, and in particular Muslim communities, may not take up the vaccine has caused some concern, and we really wanted to use this opportunity to speak to experts and sort of get to the bottom of why this might be, and also really to understand more about the COVID vaccine and why people should learn more about it. And hopefully at the end of today's session, people have much more of an understanding about why there might be some hesitancy around the vaccine, and have much more information about the vaccine and COVID itself as well. So just to let you know, for the format of today's webinar, we are hoping to have a much more sort of interactive webinar. So I'm going to be coming to each of our speakers with a question and then ask them to give us their expertise and speak about that area for a few moments, and then at the end, or after I've gone through everybody and everybody's had a chance to kind of give us their expertise, we'll be opening up to questions to our audience. And thank you very much everybody who is attending. Please feel free to introduce yourselves in the chat box. We've left it open. Please feel free to use the question answer function to ask your questions, and if at any point you want to say anything else, please feel free to use the chat box. And I think that covers everything. So I will now open up and I will start today's session. And first of all, I want to come to Imam Qari Asim, who is going to give us a few reflections about, about the whole pandemic, but also, Imam Asim, I'd be very grateful if you could just give us a short sort of if you could tell us why it's important for us to be engaged with taking the vaccine and promoting it. Thank you.
Evening, everyone. Thank you, Akila. Assalamu alaikum. So I'm Deputy Chair of Anti-Muslim Hatred Working Group, and really delighted you to be joining us this evening to have this interactive session. So from my perspective, I'm going to very briefly talk about some of the work that imams and mosques have been doing, the faith leadership has been doing to engage communities. During the first weeks of December, we realized from communities that effectively there was some hesitancy and there was some skepticism. Now, effectively, this is not exclusive to BAME communities. Anti-vaxxer movement is very powerful, and the majority of the anti-vaxxers online tend to be from non-BAME backgrounds. But having said that, I think what we realized effectively with close-knit communities, some of the material that was being shared via WhatsApp and Telegrams was very powerful and very hard-hitting. And we have had a couple of incidents in Yorkshire, where effectively outside a vaccination centre, someone making a very passionate speech about why people shouldn't take the vaccine, and the claims included that the vaccine wasn't halal. It wasn't permissible under Islamic law. So as faith leaders, we realized that there were three levels of the level of concerns and the anxieties that people had. Firstly, from religious perspective, and I think that's very, very understandable. People wanted to know whether they could use the vaccines that were being administered in the UK. So MINAB, and Imam's National Advisory Board, along with other Muslim organizations, scholars across the world, as well as the doctors, in particular British Islamic Medical Association, and other doctors. We work together to look at the substances of these vaccines, and we expressed our confidence that these vaccines were halal, they were permissible under Islamic law, they didn't contain any gelatin, any pork, any animal product, or human embryos, and as a result, no, they were absolutely fine for us to use. Now, it was fine by just preaching that, but we wanted to highlight that effectively, through example, inspire confidence in communities. So when MINAB ran a campaign whereby for 4 weeks at least, there will be sermons dedicated to addressing religious concern as well as misinformation. Whether it's going to result in people being tagged, whether it's going to result in genetic modification, and I know other panelists will speak about that, so I'm not going to go into detail about that. And so we in our sermons address those concerns. And then I think there's a third layer of I guess the hesitancy, and that is mainly amongst the young people. There's lack of trust in public institutions. There are structural inequalities, I guess, in public institutions that has resulted in that skepticism and lack of trust. Now, this is not going to change overnight, but what we were saying effectively, let's just focus on the issue at hand, and that is a very real one. So as part of my role, I can list a few examples in terms of having to mediate a particular family where the father had been lost to COVID, mother was an elderly woman, and her source of information, I guess, were her children. And one of her sons was quite into 5G conspiracy theories, and therefore he was asking his mother not to take the vaccine because it's going to result in genetic modification or 5G radiation. And so you can see real dilemma. Someone, the rest of her family wanted her to take the vaccine, but she didn't want to take it because of whatever one of her sons was saying, and so we realized that actually the trusted advisors, whether it's local GPs or community leaders or community champions, they are really important in this pandemic. And I've been saying, messenger is as important as the message in this pandemic, and part of our campaign is please verify before you amplify. It's really important that misinformation can cost lives. So effectively, I think we've seen results of that campaign, along with everyone else who's been really working hard to debunk some of those myths and address misinformation. And obviously, last week we hit the grim milestone of over 100,000 lives being lost, and I think that really highlights the urgency and of this campaign. Of all of us working together to address some of those myths and misinformation. And obviously, this afternoon we've heard Sir Captain Tom Moore as well, who's died from COVID-19, and I think it's opportune moment for us to just pause for a while, for a minute of silence and prayer, as the Archbishop of Canterbury and Archbishop of York also invited the nation, prayer for the nation every day, 6 o'clock, to allow collective time for pause, reflection and prayer. And Imams also held a prayer last Friday, just remembering all of those. I mean, so many of us have not been able to say a proper farewell according to our traditions during this pandemic. But as believers, we believe that we take comfort in the fact that whatever may be missing in their farewell from the living, they shall have an honourable reception in the next world with their Lord. Our belief is that in death, life doesn't come to an end, but life is transferred to another realm. And we pray that God Almighty grants all of our loved ones a happy abode in the next world. So if I could please ask everyone just a minute of silence to reflect and pause and pray for all those who've been lost during the pandemic. Thank you so much. I'm going to hand it back to Akila. Thank you, Akila.
Thank you so much, Imam Kari Asim, for those reflections. I'd now like to introduce Rosie Carter, who is a senior policy officer at Hope Not Hate, and Hope Not Hate have recently done some polling and research into levels of vaccine hesitancy amongst Black and Asian and ethnic minority communities. So Rosie, if I could come to you and ask you, if you could tell us a bit more about the findings to set the context for this discussion.
Brilliant, thanks. So I'll just give you a few headlines. So we carried out 2 sets of polling over Christmas. We carried out a nationally representative poll of around 3,000 people. And then in January, we carried out a poll of Black and minority ethnic Britons, about 1,000, because they tend to be underrepresented in much of this data. And we knew that vaccine hesitancy was much higher, or had been proven to be much higher among minoritized communities. So just a few headlines. So what we found around vaccine hesitancy reaffirmed what we've seen from people like the Royal Society of Public Health, that vaccine hesitancy was higher among BAME Britons. So where 77% of the white British population said they probably or definitely will get the vaccine, we found that among BAME Britons, just 65% said they probably or definitely would, and around a quarter said they wouldn't. And again, this is higher among Muslim Britons, where 62% said they would, 19% said they probably wouldn't, 8% said they definitely wouldn't. So again, it's important to look at the fact that it's vaccine hesitancy, not necessarily overt anti-vaccination. There's a lot of uncertainty. People are much more on the side of probably than they are on definitely. But again, there's a lot of hesitancy around the safety of the vaccine. So we found that just over half of Muslim respondents said that they were confident that the vaccine was safe. 45% said they weren't. So it's quite a large proportion of the population, and it compares to 63% of the nationally representative sample who felt it was safe. So there's much greater concern about the safety of the vaccine among British Muslims. Again, we've seen a lot of commentary around conspiracy theory and misinformation as the driving force behind this hesitancy. But our findings show that that is not necessarily the case in itself. So when we asked Muslims who are hesitant or opposed to the vaccine why they felt this way, they were much more likely to focus on safety than they were on these kind of conspiracy theories about the vaccine being poison or being malicious intent to harm. We also had reasons like being scared of needles, or another was having a bad experience within the health system, which was again much higher among BAME respondents. And again, there's reasons of structural racism behind that. But it's important again to stress that the why of this hesitancy, and that I think that kind of leads us to what we can do to push back against it. So again, there's been a lot of talk about Muslim hesitancy because it might be against people's religion. We found that only 12% of people who said they were opposed to getting the vaccine said that it was because they'd been told that it was against their religion. So while this figure was 4 times greater than it was against BME Christians, so there is some truth within that, it's still affecting quite a small proportion of the population. So what's more important really in trying to persuade people to get vaccinated is around trust. So we know that it's hesitancy, it's not overt rejection, but we also know that there's a lot of room for persuasion. And we know that people are much more likely to trust those who are already trusted. So family and friends, but also their local GP and local doctors and nurses at a hospital. And we found that 45% of Muslims say that they would be convinced to have the vaccine by religious leaders. So all of these trusted figures are going to be really, really important in the push to get people vaccinated. But there's also some points around that there's a lot of collective obligation and a sense of duty. So we found that more than half of British Muslims, so 57%, said that they really felt that there was a duty to get vaccinated in order to protect the vulnerable. So there's a lot of room for positivity as well in moving forward. So just to kind of wrap up, I mean, these two things are completely intrinsically interlinked. So trust or mistrust and misinformation. When people don't trust the voices that they're hearing on things like vaccination, they're much more likely to agree with the misinformation that's coming through in defence. So it's really, really important that trust is rebuilt. So there's a long road ahead, as well as challenging misinformation, to reach out and engage with marginalised communities to build trust for public health experts. Thanks very much.
Thank you so much, Rosie, for those insights. And, you know, it totally reflects my own sort of family and community networks. I mean, my mum was very worried before she got her vaccine, but actually it was her GP who sort of, you know, reassured her, and he was there at the vaccination centre, and that really helped her. So thank you so much for those insights. I'm going to now go to Dr. Adil Riaz, who is a Birmingham-based GP, and he's a member of BAME as well. Dr. Adil, could you start by briefly telling us how these new different vaccines will work? Because there's 3 of them that have been approved so far. And I think, you know, for people out there, then they don't really understand what are the differences between them and how they work.
Good evening. Thank you very much. Thank you, Akila, for the introduction. Well, firstly, it's important to comment that when people would be, they would not get the choice which vaccine they're going to get. So yes, for knowledge purposes, it's important to know which vaccines are out there and how they work. But it's very unlikely that you will be given a choice unless you suffer from significant allergic reaction or you're housebound. That would affect the choice of the vaccine you're going to get. So there are 3 vaccines at the moment, but actually there are 2 which people are getting. Pfizer and AstraZeneca. They're quite popular household names now. So Pfizer vaccine, it's mRNA vaccine. So mRNA is a relatively new technology, but it's not that new. So some people say that was the first time they've developed a mRNA vaccine. It's actually not true. In 2003, there was an mRNA rabies vaccine. But obviously mass production is the first one. The AstraZeneca, which is the Oxford one, is a relatively older technology. And both of these vaccines, the basic aim is that it develops your body's immunity to fight against the virus. So that once the real virus gets into your body, your body knows that how to fight it. So to build your immunity. The Pfizer vaccine, it does have some reported cases of anaphylaxis, allergic reactions. So it's not recommended for the people who suffer from significant allergic history in the past. So, for example, if they carry an EpiPen. So if you suffer from normal hay fever here and there, then it's okay for you. Plus, it's also temperature controlled. So it needs to be at specific temperature. So people who are housebound, it's probably not suitable for them. So AstraZeneca vaccine does not have any allergic element into it. So both of them are 2 dosages, and in the trial it was 3 weeks apart, but now the government recommendation here in the UK is 12 weeks, and we can talk about that if there's any question related to it. But the main reason behind that logic is so that everyone can get the initial protection. So that's the initial brief description without going too much into the science. I'm not a virologist anyway. but without going into too much detail, this is how the vaccine would work.
Thank you for that overview. And you have been working on the front line since the beginning of COVID, and we know that there has been a lot of misinformation. So could you tell us, what are the kind of main sort of themes or misinformation that you've encountered, and where do you think they're coming from, and how do you counter that when you're speaking to your patients?
Well, yes, as my role as a COVID-19 GP, since it started, I've been working as a website and a home visiting GP, and more importantly, as a BAME member. So in BAME, we obviously on a regular basis get to hear these conspiracy theories or misinformations. So there are some genuine concerns. There were some genuine concerns, there still are, but most of them are actually hearsay, which people get to hear in the social media. And I agree with what Kari Yasin said earlier. Actually, this time it's a bit different. Normally, we say that the BAME community, it's because of the language barriers, or they're not assimilated, integrated in the community properly, that they don't sometimes feel the same narrative as the whole society does. But this time, actually, what we feel with the vaccine, it's mainly coming from younger generation who have more access to social media, who are more prone to these theories that come from various different places. So what common things we hear? All sorts of things, to be fair. They're 2 or 3 every day, some new things we hear. Most of them relate to actually COVID itself. There are lots of people who still believe that COVID is a myth, and the deaths are over-exaggerated. Actually, today I had a patient, elderly patient. I went for a home visit, a COVID patient, and before I went, the GP surgery referred the patient, received a call from the son, who was very, very angry that how dare you refer my father to a COVID doctor. So and that actually was not a BAME person. He was a white nationality, local. So it's obviously quite widespread. So COVID itself, there's still people who believe that the figures are manipulated. The regulatory bodies, MHRA, there's conspiracies about those, that they've taken money from Bill Gates, or they take money from pharmaceutical companies. So the actual issue with COVID itself, and then the messenger or the regulator, they address that. And then the vaccines and all sorts of things about vaccines, depending on which background you are, the issue would be addressed to you. For Muslims, obviously, they would say it's not halal, or it's not suitable for vegetarians. Then they would talk about it affects your fertility. And there are some information is authentic, scientific, but it's mixed with the half truth and half lie, and that's how they confuse people. The latest one is about fertility. Obviously, the issue about the vaccine developed too quickly, that was a genuine concern. As a doctor, I was concerned about this as well, until I read the actual all the trials and the MHRA recommendation and the detailed reports. They were all public. Once we read all that information, then we build the confidence. So that was, I think, probably was the genuine concern. But I agree with what Rosie said, that majority of the time it probably has not happened where I met with a patient and tried to talk with him, and at the end of the talk, they were not convinced. So I think the role of the GPs, if they get the time, and the nurses, and if the government can support through counselors to advise people about this, so people do listen. There are some hardcore anti-vaxxers who've got political agendas or whatever that no level of evidence would convince them, and one sometimes has to take a break from them. But general community, masses, actually, you're able to convince them if you talk them through.
Thank you so much. I'll now move to Dr. Mohammed Abbas Kaki, who is also a GP, and he's also a commentator on health issues for mainstream media. Dr. Mohammed Abbas, if I could ask you about the potential side effects of having the vaccine. We also have a question about potential side effects, but from what I've been hearing, when I speak to women, this has been a key worry for people. What are the side effects?
Sure. Assalamu alaikum, everyone. Peace be upon you all. Thank you for this really great seminar so far. I mean, the potential side effects of the vaccine are actually very similar to other vaccinations that we have, but they are fairly common, unfortunately. So you can get a sort of a painful, heavy feeling, sort of tenderness in your arm where you've had the vaccine. So I had mine in my left arm, and I still have thoughts about it, but it was quite painful, but it goes after a few days. The other sort of symptoms you sometimes can get are feeling tired, headache, general aches, or mild flu like symptoms. And again, they're quite common. And all of this is because we're injecting you with a vaccination, and we want your body to react. We want your body to say, right, I'm mounting a response. I'm ready to prepare. Now, the good thing is, as the doctor has just said before me, is the vaccination we're giving you is a weakened, a dead, an inactive virus, but it's going to make your body react. So you're not going to be getting the COVID-19 injected, but you are going to have something that makes your body react. So you build up your immunity and are able to protect yourself if you do encounter COVID-19 again in the future.
Thank you.
There was a question in the Q&A which I might segue onto, since it's, if that's okay with you. Or
yes, please. No, go ahead. I think you can
yeah, it was about fertility, and I think Dr. Riaz mentioned, touched upon it, and I think, you know, BAME have done some fantastic work. So if anyone is watching and wants to know more, BAME have done some really great work in this field. But the good news is that the chair of the Royal College of Obstetrics and Gynecology, so, you know, the authoritative body, the body we look for information about women's health, has said, and he's addressed this, his name is Dr. Edward Morris, and he said that, look, we want to reassure women that there's no evidence that gives anything that suggests that COVID-19 vaccines affect fertility. So claims on that are just speculative. There's no evidence or data that supports this. And of course, when you look at how the vaccine works, there's no biologically plausible way. There's no way from the mechanism of how the vaccine works to actually cause this or impact on fertility. And there's no evidence at all, no research that shows that the vaccine affects fertility. So that's been very reassuring as we go forward, and as many women have been concerned about that news that's come out.
Thank you for answering that question. If I could just ask you quickly about the booster vaccine. You know, does that have any side effects? You know, how does that work?
Well, it's similar to the first in some ways. Colloquial evidence, or colleagues of mine have said that the second vaccination it causes more of a side effect than the first one. There's no reason for why that would be, and I would suggest that I wouldn't overly worry about having a second one. It's going to be the same sort of thing. The two are working to build your immune system, and again, we're looking for reaction, but it will be the same sort of thing you've seen already.
Thank you. And Dr. Adil touched on this, but you know, just to ask you, how have they managed to develop the vaccine so quickly? I mean, this has concerned a lot of people.
Yeah, and I think what Dr. Adil said is very true. All of the medical professionals, myself included, were thinking, hold on, this is very fast. And that's why we did a lot of research and looked into it to make sure we were happy and had our vaccines. And I've had my vaccine, so, you know, I wouldn't have done that without really looking into it. Now, what it is first of all, we've got to remember, this research hasn't just come from nowhere. We have been working on coronaviruses. There's a family of viruses for a long time. There's been a lot of research on the SARS virus, the MERS virus. These were all things we knew about, we've been researching. So we had a lot of information already. So we were already at a good starting point. The second thing to say is this has been really a year where humanity has really shown how incredible it is when it comes together and collaborates. So we've worked together, all the different labs, to assure that we can speed up the process, share our data, and get to a point where we can get a vaccine that can potentially be a life changer and a lifesaver. Now, the most important thing is to say that we can rest assured that no steps were skipped in this process. The only thing was that when there was sharing information, we would then be able to go through things a bit faster. But the vaccine trials, normally there's a lot of waiting around, there's waiting to get permission and funding, but because we knew that COVID-19 had stopped the whole world, everyone was waiting for this vaccine, there wasn't that need like previous vaccines to have to justify why we need it. So that was a step we could go that normally takes 2 or 3 years, happened in a day or two. And of course, there were other things that happened that were really good. You know, we were previously not able to get people to come for a vaccine trial, but on these vaccinations, we've been able to say, look, if you want to come and support us, come forward and have and be part of the trial, and that's meant we'd be able to get more people quicker. And of course, the really, really reassuring thing is, once the vaccines were produced, they were independently reviewed by the Medicines and Healthcare Products Regulatory Agency, the MHRA. That's an independent process, nothing to do with the vaccination or the companies that have produced it. And they've reviewed them and said they're safe. And that's not just been in the UK, that's been lots of different countries also going through different processes. So it's been very reassuring, and that means that, you know, we have a lot of confidence to say that they're safe.
Thank you. Thanks for that, and thanks for touching on the regulatory bodies and the sort of checks and balances that are in place to ensure that the vaccines are safe. I'll now like to move to Dr. Shamaila Anwar. Dr. Shamaila Anwar works in clinical research within the NHS. Dr. Shamaila, you've written about why there is this reluctance amongst Black and Asian and ethnic minority communities to get vaccinated. Could you talk to us a little bit more about that and some of the things that you've learned in your research?
Thank you. I'm not a vaccine expert and I'm not a medical doctor, but I work on initiatives to help increase awareness of the importance of vaccination and research. I work for the National Institute for Health Research, which is the research arm of the NHS. And I think that within the UK, we're in a really unique position because we've got a National Health Service, but embedded within that, we've got a research system. So, you know, one of the main reasons why we're able to deliver vaccines, identify, trial and deliver vaccines has been because of this embedded research system. And I think that this is kind of where I want to start, really, that, you know, it's all well and good for us to be able to sort of send out these facts, but there needs to be an engagement with communities about what their concerns are. And this is kind of where the NIHR in particular has been leading the way, because a lot of the trends we now see in vaccine uptake were the trends that we started seeing at the very beginning when the pandemic started, when we were asking, you know, back in March, everything, you know, in terms of the research in other areas had to sort of be paused and we had to realign. So, you know, and we call this the urgent public health response within the NIHR. So there was a system in place. We stop, we realign, everybody's redeployed into different areas. And, you know, we then start the process of identifying relevant trials, first and foremost, with, you know, on the virus itself, then the treatments, and then obviously the vaccines. And kind of when that happened, we knew very early on that there was a disproportionate number of people from the Black, Asian and minority ethnic groups that were being affected by the virus. But there was a bit of a disconnect because we weren't recruiting participants from those communities to come forward. So we saw these trends at the very beginning, and that's the reason why we developed the initiatives such as the Covid-19 initiative, which is very much about engaging with communities. And I think that if we want to sort of understand the aim of that, the aim is to actually understand the communities that we serve. And that's kind of where we want to start from. We want to develop that two-way bi-directional communication with communities and understand what makes them tick so that we can serve them better. And, you know, one of the, I mean, the end product for the Covid-19 initiative was a set of short dramas and, you know, helping people through their vaccine journeys, we call it. So, you know, vaccine hesitancy is entirely normal. That isn't anything new. I saw that myself with my parents and the flu vaccinations in the 1990s. You know, there were many years where they didn't take it, and then slowly they started understanding the importance of actually having the vaccine. And now it's been the last 7-8 years, they've actually been going ahead and having the vaccine each year. So vaccine hesitancy isn't normal. Neither is our wanting to understand what we put in our own bodies, whether that's food, whether that's drink, whether that's whether that's an injection, whether that's a vaccine, whether that's a treatment, whatever. It's entirely normal. And I think that what we've learned through the work that we've done is we've brought communities together with vaccine experts, with healthcare professionals, so that these people, the clinical community, the research community, can hear firsthand what the concerns are of the communities. And there's quite a few points that we've learned. We've learned that calling these concerns that communities raise myths is actually quite reductionist and quite, you know, it's quite insulting to them. Digging down deeper into the issues that have been highlighted to us, or the concerns that have been highlighted to us from communities, we found that actually in almost all cases, those concerns are based on something. Therefore, they're not myths, they're actually beliefs. Whether that's because of, you know, whether that's based on a particular, you know, religious belief, or whether that's a historical experience of a badly run clinical trial, it's based on something. And it's, you know, we're duty bound as people working within the healthcare system, whether that's research or whether that's clinical, to help to address these concerns in an appropriate manner. And, you know, quite a lot of the concerns that we've had from the Pakistani community have been very much around, you know, how do they reconcile having a vaccine with their faith? So something, you know, quite at a spiritual level. Some quite practical considerations, i.e. are the vaccines halal, you know, will they affect my fertility? All those kind of concerns as well. But the main thing is that that these concerns are based on something, and it's about engaging with those communities and understanding what makes them tick, and actually developing resources with them to help, you know, get the messages out there. So the monologues that we put together are culturally relevant. It's ensuring that we're able to communicate with all sections of society, not just people that can read and write, because literacy is a concern across all communities. And it's helping to empower communities to take control of their own health and their well-being. And I think that's the kind of where we're at with it. I think it's been absolutely joyous to see all parts of my community, the British Pakistani Muslim community, coming together and saying the same thing. So, you know, Imam Asim, you know, I've got people, you know, from the acting field, you know, healthcare professionals, community leaders, all coming together to say the same thing. And I think that we're actually starting to turn a tide now in getting the messages out there, and people actually taking responsibility, not just for themselves, but for their communities as well.
That's really helpful, thank you, and really positive to hear as well that you know, the tide seems to be turning. And just to kind of ask you, you know, what, you know, for healthcare workers or, you know, people on the ground who work with communities, what would you say, what advice would you give them? What's effective in trying to understand communities and kind of, I guess, reassure them or change their mind?
I think first and foremost, language is key. It's really important that the language that you use, you know, so things like, you know, I touched on the use of the word myth. It's not a myth, it's a belief. I think it's understanding what makes that community tick. And in order to do that, you need people from that community to engage with. I don't just mean patient and public representatives, but people like, you know, Imam Asim, people like, you know, we've got somebody called Dr. Ruby Batty OBE in Bradford. So these are community leaders that actually understand what makes that community tick. And that's absolutely essential, because, you know, even myself as a health, you know, working in health research, you know, I'm able to speak about the British Pakistani Muslim community where I live in West Yorkshire, but I would not want to presume that I can go into, for example, the Nigerian community. It's really important that we have people that understand the communities that make, you know, that make them tick. And those are the two key points, I believe. And not going in and telling them what to do. It's about helping us understand the communities that we serve.
Yeah,
that's what the aim should be. Yeah.
Thank you so much, Dr. Shamila. And just, you know, we've been talking about patient perspective, and we're just going to spend a few minutes now just sort of hearing some of the sort of patient perspective. So if I could hand over to my colleague Riaz Ravat is Deputy Director of St. Philip's Centre, and he's also an independent member and member of the executive on the Anti-Muslim Hatred Working Group, and he's going to speak to Zufar Haq, who is well known in Leicestershire as a health campaigner, and he's also a member of the CCG clinical governing body in Leicestershire. So if I could hand over to the both of you now. Thank you.
Good evening, everyone. Akila, thanks very much. I just want to begin by paying tribute to all of the medics, the carers, those who are in the health profession on this call this evening. There are so many of you who have dialed in this evening to help us and to help our families. There are, of course, so many of your colleagues who are not on this call. Please do convey that. It's a heartfelt support and love and dedication for all that you have done, and thanks for all that you've done thus far, and may that work continue. So hats off to all of you for all that you have done. With me is Zafar Haq, who is from Leicester, and a shout out to all of those who are here from Leicester. I've noticed quite a few colleagues who are on this call from the community, but also the City Council and elsewhere. Zafar, just a couple of questions for you as somebody who's been involved in the campaigning side, I guess, for patients within the health service. As somebody who's held the NHS to account for many years on a variety of different subjects, you certainly have not been shy when it comes to objecting when you feel that the patient interests are not being served. However, on this issue, you've been a very, very strong proponent of the vaccines, a massive supporter of those. Why is that?
Well, if you look at the NHS, thank you, Riaz, and assalamu alaikum to everybody. If you look at the NHS, I mean, over the last 20, 30 years, the NHS does what it wants to do and expects patients to work around it. So it's always been a challenge between patients and the NHS. And in this particular case, this virus, when it first started, lots of people were telling me, oh, this is not real, it's fake news, it's made up, it's not true. But then if you actually go and see inside the hospitals or hear of people who have been ill, and you see firsthand people who I know who have died from COVID-19, it brings home the reality that you've got a serious problem on our hands. And the only way out of dealing with COVID-19 is the government advice. Sadly, it is correct. We've got to wash our hands. We've got to keep the distance. We've got to wear the mask. And the vaccine is the next step. You know, all of these are big hurdles that we've got to jump and get past to the end goal, which is to survive and actually be able to move on from COVID-19. It's affected all our lives. I mean, everybody is affected by what's going on, and this is the solution to the problem. So why wouldn't we take it? I mean, the BAME community is the most worst affected community. The most deprived people within that community are the most affected again. So it's a multiplier effect. So we've got to try and do everything we can to try and make sure that those people survive. The COVID vaccination, it saved your life. It doesn't stop you getting COVID, but it saved you going into hospital and losing your life. And that's why it's a lifesaver. And that's what people have to understand. And everybody out there needs to realize that actually it could save your mother, could save your father, could save your brother, could save your sister, could save any one of your relatives from dying from COVID-19. Why would you not take it?
And Zafar, you've mentioned BAME communities here, and in that regard, I know you've been involved from the outset, but from what you've seen and heard, how can agencies improve their communications to Black and multi-ethnic communities?
There's a huge lack of trust out there. They don't believe what the NHS says. They don't believe what government says. They don't believe, they all think. And parts of it is, we've had 20, 30 years of trying to brainwash people on different things. This is good for you, that is good for you, you know, butter is no good. All sorts of different messages come out all over years. And actually, we need to be honest with the public and say, actually, you know, you need to do all of these things if you want to survive. And as somebody mentioned, you know, there was a rush to get this vaccine out and everybody was worried about the vaccine. Even me, I was thinking, wow, that's really quick for this vaccine to get there. But there's reassurance when other countries all of a sudden say, yes, we've approved it. Other countries out there, you know that the vaccine is safe. You know that it works. You know that it's going to save somebody's life and actually is going to make a difference. So, you know, the trusted people within the communities, whatever background they might be from, those voices need to be heard. You hear so many other people just talking on WhatsApp messages, sending all these falsehoods out there that it will change your DNA, it will track you, it's going to you know, affect your fertility. If you want to be tracked, you just have to have a mobile phone. You're tracked anywhere you're going to go. But the reality is, we need to make sure that those messages are challenged and actually we get our messages through, because this will save your life and maybe save the life of your loved one as well.
Thanks so much, Zafar. No doubt there will be questions on the chat related to what you've said. Can I also thank you for all that you have done to try and improve health services for patients going many years? Thank you. Akila, over to you.
Thank you so much, Riaz and Zafar, and thank you to all of our panelists so far for your answers. It's been very informative. So we have had some questions coming through, and we've had another question about fertility. So if I could come to Dr. Abbas and Dr. Adil, there was a question about whether or not women who are pregnant or breastfeeding, if they can take, I can see that you've answered this already, Dr. Mohammed Abbas, but I'll come to you then, just to kind of, you could sort of tell people what you've written on the chat in relation to that question.
Sure, absolutely. I'll post the information. There's some really good information online, and I appreciate that at this stage it's very hard because there's so much information, just as Riaz and Zafar have mentioned, that it's hard to discern what's right, you know, what makes sense and what. There's a really good piece of information which I'm going to post a link on, but essentially, if you're pregnant, there's currently no data or evidence that suggests that it's unsafe during pregnancy, but because of the way we're rolling out the vaccination, unless you are a frontline healthcare worker, you're not going to be eligible yet for it anyway. Unless the only reason you may be is if you have some other health conditions that make you vulnerable in your pregnancy anyway. If that's the case, then at the moment there's no data to suggest that it's not going to it's going to cause any effect on your pregnancy. But again, it's very much for people to make that decision because the data isn't out there, so it's an evolving field. We do know, as previously mentioned, that we do give the flu vaccine, we give other vaccinations and have done so for a long time, and they all work on the same lines as COVID-19. So the assumption is there won't be a problem. For people who are breastfeeding, there's again no risk of the vaccination, and if you're eligible, if it's the time, you know, we got to that stage, and in a few months' time, you will be offered it. But at the moment, it's only for frontline healthcare or social care workers as per the policy. And I'll post a link that has a lot more information about it, which you can people can go through at their own time.
Thank you. And just to say to everybody, you know, please do post your questions either directly to us or on the chat or on the Q&A function. We've got a question about the far right, because there was some evidence that the far right had been targeting Black and Asian and other ethnic minority groups with misinformation. Dr. Adi, if I could come to you, and if you could perhaps just enlighten us a little bit about this.
You're talking with me? This was, to be fair, a surprise for me as a frontline clinician when we looked at this angle. Like Karyasim said earlier, that yes, Black and minority ethnic groups do get affected with these theories or conspiracies or myths or beliefs, but they actually start from a specific group, and majority of them, if you look at the commonly used websites and you look at the people who are running those websites, you'll have a fairly good idea where they come from. I was actually involved in we keep an eye on all the common videos and social media chat about anti-vaxxer messages that goes around. And I was listening to a doctor who called herself as a frontline doctor from US, talking about antibody priming and all the other type of scientific language, and telling that vaccines would affect your immunity. And then after 2 days, that doctor got arrested in the Capitol riots. He was actually involved in the riots. So, and then when we did media search, we realized that there's actually a few articles on Guardian, on Politico, where they looked at the social media and they realized that a white supremacist and the anti-vaxxer group in US have close links, and in Europe, the fascists and anti-refugee groups have close links. So there's plenty has been written about it, and sometimes we notice that those same groups who sometimes link up with anti-vaxxers and then come up with certain theories, they are the first one to blame the Black and minority ethnic groups for flouting the rules, or I actually live in the postcode where this new South African variant has been found, and I already see on the social media the comments going on about the minority ethnic groups involved in, and that's why the virus is spreading. So the same group who actually spread these initial messages about causing confusion about the vaccines are the first one to blame the minority group. And it's important for the people from the minority ethnic groups to be aware of this part of this anti-vaxxer movement as well.
Thank you for that. It's really interesting. And we actually conducted some research last year at the start of the first lockdown about how there was a lot of misinformation spread by, anti-Muslim haters, I guess, who were blaming, as you say, Muslims for the spread of the virus in the UK and elsewhere. So we've had another question on the Q&A that's come through, and I'm just going to ask Dr. Mohammed Abbas to answer it as well, please. And this question is about the limitations of the vaccine.
Sure. So the question for anyone who can't see it is, what are the limitations of the vaccine? What should our expectations be? Can it prevent us being infected or spreading it? And would we still have to practice distancing, masks, etc.? Well, essentially, as you may know, there's lots of different vaccines out at the moment, and they have different effectiveness. Some are 85, some are 90%, but essentially, they're hoping to prevent us from getting unwell with COVID-19, but there's still a chance we can catch COVID-19. So normally, whenever you've had any vaccination of the COVID-19 vaccines, you have 21 days from the point of the vaccination until you are in a position where your body is primed, is ready for a vaccine, for the virus. So should you pick it up in that 21 days, COVID-19, you still would get it, and you may not respond as strongly as you would 21 days after. Of course, the question of distancing and masks is something that everyone is hoping the vaccine will give us that semblance and that return to normality, aren't we? We're all hoping that we can stop wearing our masks, spend time with our loved ones, and be closer to everybody. But until there's sufficient people who've been vaccinated, and until we know for sure more data about the second dose and how long we have, we will be continuing, I think, to be social distancing and wearing masks because of the fact that we know that we aren't 100% protected. And we also know that the people we're coming into contact with may have the virus. And of course, it's very important to not spread it. So until we have a very good uptake of the vaccine, we want to be sure not to spread it and be careful. So at this stage, that's the situation. But I think it's really promising if we can have the vaccine, because it brings us one step closer to that hope of spending time with our loved ones and finally taking off masks in the public.
Yeah, and I'm sure we're all really looking forward to that moment where we can start spending time with our loved ones again, especially, the elderly people in our communities. Thank you. Zafar, I saw you had your hand up earlier. Is there something that you wanted to say? And also, I just wanted to ask you, from a kind of CCG perspective, you'll understand how the vaccine rollout has been working, at least in Leicestershire. So if you could just sort of talk to us a little bit about that, because it's been phenomenal, hasn't it?
Yeah, it's been phenomenal. I've been, I just wanted to mention on the sort of far right groups, they're obviously going to use anything that they can possibly can and take videos of people who are breaking the rules and use that and say, look, all of these people are the people who are spreading this virus, and use that to inflame people. But we've just got to be careful that we make sure that we obey the rules and stick to them and actually behave ourselves as much as possible, so that we can't, people don't take the opportunity to take advantage of that. On the rollout, Leicestershire's done remarkably well. We were slow on the uptake. Leicestershire didn't have a hub at the start, but the GPs have been working day and night, literally, in getting these vaccines out, and particularly targeting the city and inner city areas, the deprived areas, and all sort of community areas where there has been a high issues of COVID-19, and it's worked out remarkably well. I've been to some of the sites, and the camaraderie between the GPs, the teams that are working on there, the nurses have been fantastic. And actually standing there talking to patients as they're coming out, lots of people praying for the doctors and praying for the NHS and giving duas. It's remarkable to see and very uplifting to see how much people are thankful for the NHS and what's been happening and the vaccine and the rollout, because they know that there's an end game to this, and they can see the light at the end of the tunnel. Once they've had their vaccine, they know we're only a few months away from some kind of resemblance to normality. They can see their families, they can go out and enjoy life again. and that has been curtailed for the last 12 months. And Leicester's been in lockdown for almost a year now, total lockdown. So a lot of people are really praying and hoping that some kind of normality comes back to Leicester as soon as possible, really.
Yeah, I hope so. It has been very difficult, I think, for Leicester, especially because you have been in lockdown for over a year. We've had a question, I'm just going to open it to the panel, basically about new variants. Obviously, there's been a lot about it in the news today. You know, will we need more vaccines to keep pace with the virus? That's the question that's been asked.
Well, shall I chip in this one? Well, the new variants is nothing new, especially in coronaviruses. People know that coronaviruses, like other viruses, mutate. The issue at the moment is that the mutation is happening faster. And what the government is trying to do is to slow down the spread of these mutant viruses until we can develop enough immunity in the community. So normally when the viruses mutate, their effect gets less and less, and in 5, 10, 20 years, they just become like common cold. So the worrying thing about these current mutations and the new E484, whatever number they give to this, the further variation of the Kent virus, the proteins that have changed make it a bit more closer to the one which is a South African Brazilian variant. And the issue is that might reduce the efficacy or the protection which the vaccine gives. But the reassurance at the moment which we get is that the vaccines do protect you against these new mutations as well. However, the scientists do believe that later on they might have to. And the good thing about these vaccines actually is the way they've developed them, that they're modifiable as well. So if the mutation is significant, they can modify the vaccine accordingly as well. So it's nothing much to worry about. It's not unexpected what's happening, so people shouldn't lose their sleep much over it. However, it's important to slow down the spread of these new mutations, because there are lots of people at the moment who do not have any or much immunity against these new variations.
Thank you. That's reassuring. And Shamila, we've had a question about the lessons that have been learned for ethnic minority communities and their engagement with, you know, NHS establishment, whatever, as a result of COVID. What are the lessons in terms of wider health inequalities, and what are some of the things that I guess institutions can do going forward to start to address some of this sort of hesitancy and sort of lack of trust?
Yeah, I think, can everybody hear me?
Yes.
Checking, sorry. Yeah, I think I'll go back to what I said before. It's about actually engaging with the communities that they need to serve. So that's trusts across the UK, you know, understanding those communities and developing those relationships, and that relationship with them being bi-directional. I think that's one of the key things that's come out of, you know, the pandemic, and how moving forward we need to be, you know, engaging with the communities that we're serving. I think that's one of the key aspects of it. I think the other part of this as well is kind of health literacy and science literacy, and I think that's where our young come in. I think that across the board, across all communities, there needs to be, you know, a move towards, you know, health literacy and science literacy. So understanding how viruses work, and, you know, being able to, you know, I think if we had those kind of basic building blocks right from the start, you know, our communities would be able to understand the importance, you know, how dangerous this virus is, and why they're doing what they're doing, i.e. washing their hands, being socially distant, the importance of vaccines. So I think those are the two key things: engagement and increasing health and science literacy. And, you know, this is where I'll be, you know, I'm looking to our younger members of society, you know, and being able to sort of use them as kind of, you know, the key messengers. I think there's real power in your voices, and being able to take messages back to their family and being able to sort of persuade people. And again, having, you know, I think that everybody's got their sphere of influence, whether that's within their family, whether that's within their community, whether that's across the country. And we all need to be using that sphere of influence to help spread, you know, correct information.
Thank you. Scientific literacy, I think, is really key, and this pandemic has highlighted to me personally, even though I've got a science background, how much more I could improve in terms of my scientific literacy. Zafar, you've got your hand up. Did you want to maybe comment on this?
I just wanted to add very quickly that you know, all the organisations, be it the NHS, be it all the sort of civil service, need to reflect that the community they're serving. I'm one of the voices. I was a campaigner for 15 years before I came on the inside of the NHS, but it was a real challenge because they really took a risk on having somebody like me on the board. But the difference is that I can bring them so much insight into a community, and generally that they don't always pick up. And I think you need that kind of a diverse boards and diverse influence on top of these decision-making bodies to enable them to channel through a different opinion and a different way of looking at things, to make sure that the hard-to-reach communities are not left behind. Part of this mistrust is all about those communities feel that they're left behind. They're left behind at the back of the queue on so many different occasions because they're not able to speak up for themselves. There's no voice of challenge. They're not able to be articulate enough to be able to get what they need for their communities, and they lag behind. And that lagging behind creates that mistrust and that unfairness, and that's what causes the problem when we're trying to deal with something like this.
Yeah, absolutely. And Shamila, did you want to add something as well?
Yeah. So I think that we've got to sort of think about where our communities have come from. You know, at some point in history, we were all part of the British Empire. So there's that element there. Then we were all encouraged to come to England and, you know, for a new life here, which is what, you know, my parents did and their parents. And when they got here, life wasn't what they expected, because there was discrimination and racism across, you know, different agencies. So, you know, when you've got a background of that, you've got a backdrop of that, and then you've got something like a pandemic happening where, you know, everybody needs to follow rules, and those rules are set by agencies of the government, there is going to be this pushback. And I think it's kind of understanding and acknowledging the history of our communities and where they've come from. And I think that the other part of this as well is that, you know, we do talk about, you know, the different communities, the Black community and the Asian community differently, and they're very, you know, there are different concerns that those communities raise, but there are also some similarities. And the similarities are, you know, as I've said, you know, they've been part of the British Empire, they've come into, you know, they've been invited into England, you know, their life hasn't been what they expected. So there is that discrimination, that racism and that inequality from the very beginning. And I think that, you know, organisations like the NHS are completely acknowledging that. And this is a big start. And I think we are at a turning point now where, you know, that engagement with communities and having diverse health boards, you know, are going to be the way forward, because I think to understand those communities, you absolutely need people from those communities to be part of the organisation.
Yeah, absolutely. Thank you, Shamila. And also just to ask you another question, because you've mentioned the kind of historical context and acknowledging that. And we've had a question here, so I'll just read it out. It says, in my local community, mainly Afro-Caribbean, there are strong feelings of mistrust based on past events where pharmaceutical companies, well-documented history of experimentation on vulnerable patients in Africa, including clinical trials and even withholding treatments. How do we tackle this going forward?
I think one of the first and foremost is, you know, the times have moved on, and the, you know, the regulation and the checking that takes place within the UK is kind of, you know, unsurpassed. You know, we have got regulations here that have to be followed. You know, that's, you know, both at a national level but also at each of the trust levels as well. So there's a lot of safeguarding in place. There is going to be this kind of turning the tide, particularly when there's a really bad experience, you know, and I understand, you know, particularly in the Nigerian community, the meningitis trials, you know, those the implications of those badly run trials have kind of reverberated down the decades. You know, and have caused, you know, no end of issues, you know, health issues back in Nigeria. So, for example, you know, the boycotting of the polio vaccines and the havoc that caused. So it is going to take time, but I think that we, you know, it's through reassurance, it's through validating people's concerns that we're going to get there.
Thank you. Thanks so much for that. We're coming to the end now of our session. I wanted to thank all of our panelists and thank everybody for coming. But before we end, if I could just ask each panelist just to kind of give just a few sort of 30 seconds, just final words or reflections. And if I could start with you, Rosie, and sort of work up along my screen. I can see Rosie and then Adil and Zufar, and just kind of work that way, please. Thank you.
Yeah, I mean, I think I would just reaffirm what everyone said, that it is about building trust. It's about those trusted figures getting the messages across, and it's not too much of an uphill struggle, but the work needs to be done.
Thank you. And Dr. Adil, final reflections from you.
A couple of quick things. Firstly, you know, as Muslims, we are always in the headlines, and we're used to, oh, Muslim story again. And when we hear these things in the news again, that Black and minority ethnic or Muslims are among the higher groups, so the community in general feels that, oh, you're in the spotlight again. So sometimes it helps. The message needs to be like, all of us are in this together. So a white, Black, Asian, all of us in this together. So let's have it together. So a message of union rather than highlighting or pinpointing a specific community again and again. And the message to general audience is that if you have any concerns, speak to your doctors, speak to your people who you trust, rather than those who are hiding behind the virtual screen.
Thank you. And Zufar, last reflections from you, please.
Yes, thank you. The two biggest things that have helped save people's lives, the number one is clean drinking water. The second thing is vaccines. So they're the two most important things that have helped save people's lives. So I would urge everybody to take the opportunity to take the vaccine and then still carry on following the advice of hands, mask, and space, and make that really important, because that has to carry on, because there's going to be lots of different mutations coming in. We've just got to keep safe. And finally, I wanted to say huge thank you to all the NHS staff and the support staff and the key workers up and down this country who have made a huge contribution, huge sacrifices to make sure that we're all safe and we're able to feel safe in this country, and be able to make sure that people who have fallen ill, even when family members have died, people have come back to me and said, the NHS was wonderful. They were fantastic. They did everything they possibly could. And we need to make sure that we cheer and respect them for their hard work that they're doing, not just today, but over the many, many years, over the previous many years as well. So thank you.
Thank you so much. And Riaz, if I can come to you.
Thanks, Akila. I guess just to remind everyone that the first medic who passed away with COVID was, of course, from the Muslim community, lest we forget. But also just promoting this is about the people that we have, people that we have on our mobile telephones. We can be messengers of goodwill and messages of safe vaccination as well. So we have the power to do that. Let's use that in a responsible way, contact those around us and try and turn the tide, because this has taken away far too many lives as it is.
Actually, the first 8 doctors who passed away were Muslims.
Thank you. It's a stark reminder of just, the situation that we're in. And Dr. Mohammed Abbas, if I could come to you for final reflections, please.
Thank you. Yes, I had 2 things I wanted to say. From the beginning of this pandemic, I've worked not just in my general practice clinic, but actually in hospital. I've been working there for the last 12 months, helping with the COVID-19 situation. And my role is assessing patients with COVID-19 as they will come into hospital and working out how we need to treat them. One of the things that has stood out is the unbelievable danger and symptoms, but also the unpredictability of COVID-19. We can't tell if you're a 28-year-old who was previously well and you're going to end up in intensive care, or if you're a 28-year-old who's going to have a slight cold and be fine. And that unpredictability means we are in such a precarious and scary situation that taking a vaccination to help prevent something like this goes without saying, really. And the other thing that we've been dealing with as general practitioners and healthcare staff has been long COVID. Long COVID affects 1 in 5 people. So even if you got COVID-19, you survived it, you're okay, 1 out of every 5 people who get COVID-19 can develop long-term breathlessness, exhaustion, fatigue, headaches, confusion. It's a risk we just don't want you to take, and it's not worth taking when we have something like a vaccination. Ultimately, this is about risk and benefit, and the risk of either becoming very unwell from COVID-19 or from developing long COVID versus a vaccination which has been proven to be healthy and safe for you. There is, it's a no-brainer. So my advice once again is please do have the vaccination as someone who's seen the devastating effects of it firsthand.
Thank you so much. And lastly but not least, Dr. Shamila, if I could come to you for some final reflections, please.
Yeah, I'll make it brief. So I think that we've had a very, very difficult year, and the whole kind of very fabric of our society across all the different communities has been affected. I mean, you know, for the Muslim community, you know, we're used to having our doors open. You know, we consider visitors to be blessings, you know, and we don't know how not to be sociable. And I think if we want to get back to some kind of normality, it's really important that we follow the rules, and we also consider having a vaccine. And I think my urge would be that if you get the call up, please go. Please ask any questions or any concerns that you may have. We're here, my colleagues in the health service and across the research and clinical community are here to answer all your questions. It doesn't matter how silly you think it is. We're here. We're not here to judge. We will answer them. But please, do when you get the call up, please do go and get vaccinated. I think that's the key thing I want to say.
Thank you so much. And I'd like to just take a final moment to really thank all of our panelists today. Thank you for your insights and your reassurances. And really just to echo what everybody said, if you're in any doubt at all, please contact your GP or somebody that you trust, somebody who has some knowledge in this field. And that's it. Thank you so much. We've recorded today's session, and we'll be putting it up so you can get in touch with us if you want to have more information about the panelists or anything else. And you can also share today's recording with anybody who might have any doubts or concerns about the vaccine. Thank you again. Take care.